Hey everybody, this is Dr. Pat here with Swan Lake Chiropractic. Today I'm going to be talking about spinal decompression. This is a fancy tool we use here in the office a lot. We get a lot of patients really good results with it. So the first thing I want to do is explain exactly what we're doing when we hook you up on this machine. You can either use it for your neck or your low back. So your disc is actually made out of like a gel-like material. It's kind of like a jelly-filled donut. So a lot of our patients that get on this machine have either a herniated, prolapsed, or extruding disc. So what that means is the gel is leaking out. So what the spinal decompression machine does is me as a doctor, I set very specific settings, and the way it works is it pulls a certain weight and then it holds for a certain amount of time. Goes back, pulls, and holds. So it's kind of a cycle. It's pulling and stretching, going like this with the vertebrae. What that does is it creates a negative pressure effect within the disc, which helps suck up that herniated material and help the patient heal faster. And sometimes we can even avoid surgery with this machine. So Stacey here is going to be my patient. I'm going to be hooking her up for a low back, like I said earlier. We can also do it for the neck. So first thing I want to have, make sure my patient's not wearing a belt, anything in her pockets, anything like that. So I'm just going to have her lay on her back. I want your belly button about right here, Stacey. Okay. And positioning is very crucial when setting somebody up because you don't want to pull somebody crooked. So I'm just going to have you scoot to your left just a tad. There you go. And she looks pretty good right there. So there's 3 different straps we use to hook you up. I'm just going to have my patient lift her arms up. The first one is the bottom strap right here. And we make sure we hook these very tightly just because that gets us the best results. So I'm going to cross this like that. It's like very tight. And then the next strap is what we actually hook the machine to. It's this little belt here. So we make sure that's nice and tight. And then the next step is hooking her to the actual machine. So I'm going to hook this little thing on the loop. We have another loop here. And then this is where the machine actually hooks up to the patient. Okay, and then we just have one final strap. This one is very tight as well. Go like this. Good. So she's all nice hooked up and snug. And then one final step for the low back is in order to straighten out the lumbar curve, because your lumbar is kind of curved, we put these bolsters underneath her knees just to flatten that curve out, make sure we're pulling it at the optimum angle. So I just make sure my patient's comfortable. You okay?
Sounds good.
Cool.
Sounds good.
So then next we set the angle, which goes after the certain segment I'm trying to get. So if it's an L4 herniation, I set the correct angle to make sure we're getting at that L4 level. And then I also set the hold times and the wait times, which is very specific to each patient. So any questions, just give us a call.
Chiropractic is great, and so are you.